Test for assisting the family. Have in her stages infancy to adolescence. Infant. Learn to walk. Introduce solids. Start to talk. Begin with stable sleep. Preschool. Able to communicate and understand. Performing self-care activities. Knowing the difference between genders. Right from wrong, good from bad. They play with others and have a very vivid imagination. Family relationships. Middle childhood 6 to 8. Social and physical skills needed to play games. Control over their bladder. Get along with other children. Very active. Behavior and attitudes appropriate to their gender. Basic reading, writing, and arithmetic. Develop a conscience and morals. Have a good feeling and attitude about themselves. Late childhood. Body changes. Independent and depend on oneself. Develop and keep friendships. Understanding holistic needs, mind, body, and soul. Moral and ethical behavior. Increase in muscular strength, coordination, and balance. Learning to study. Peer pressure. Adolescence. Accepting changes to body and appearance. Accepting male and female role. Independence. Psychological and social development. Adolescence for female is increase in breast size, pubic and axillary hair, slight deepen of voice, widening and rounding of the hips. Male, facial hair, pubic axillary hair, arms, chest and legs, increase in neck and shoulder size. Terms, regress, returning to a former or less developed state. Nuclear family, a family consisting of a father, mother, and children. Monarch, time when menstruation first begins. Disability, the loss of physical or mental function. Congenital, present at birth. Mood changes in adolescence caused by hormonal changes, peer pressure, self-esteem issues. Question, true or false? Do you support new mom? Yes. When should breastfed babies burp? After every breast. Change their way of living? No. Signs and symptoms, there is an issue to report with baby. Fever, less than 6 diapers in 24 hours. Green stool, diaper rash. Drainage with circumcision, bleeding from the umbilical cord. Procedure to bathe the baby. Identify 3 safety issues. Threads in socks. Don't take hands off the child. Never use tub thermometer. Mom's needs are always met first. For the baby bath, have supplies all ready. Keep baby clothed with water, laying on a towel. Wash eyes, face, ears, neck, and dry them. Pick them up in a football hold, wet with a cloth. Their hair, apply shampoo after warming in hand. Wash hair, rinse well. Lay baby back down, dry the hair, remove the clothes, put in the tub. One hand on baby, wash, soap in the other hand. Use your hand to wash arms, chest, back, legs. Rinse with a cloth. Use cloth, put soap on, lay baby back, wash front of the peri. Lay baby or tip forward, follow through with the anal area. Hold babe well, take out of the tub, dry well. Lotion if the parents request, not in the hot spots though. Dress them and then comb and brush their hair. Erik Erikson, 65 plus. Know it and describe it. Integrity versus despair. Person accepts life as fulfilling. If not, they will have difficulty with aging, death issues, and may have feelings of hopelessness. They are cranky, not happy. they don't care. Developmental disability. A disability that a person is born with or that begins before age 18. Maslow, how basic needs met for a family. Physical needs, the need for safety, love and belonging, self-esteem and self-actualization. When working with the family, you're indirectly supporting relationships. Provide family with basic care and support services. This enables the family members to invest more time and energy in their relationships. Respect the client's definition of a family. Disease and disorders. Down syndrome, condition of an extra chromosome. Autism is their own little world. It's a brain disorder, unable to show affection, social and interpersonal issues. Epilepsy, disturbance in the electrical function in the brain, not unusual with a person who has had a brain injury. Cerebral palsy, motor skill issues, brain damage due to decrease in oxygen at time of birth. Signs and symptoms, spasms, seizures, plegia, decrease in muscle, decrease in ability to chew, uncontrollable contractions of the skeletal muscles. Spina bifida, it's a disorder involving closure of the spine, congenital disorder. First 29 days in the womb, a problem occurs with spinal development. Can cause fluid on the brain. Spine splits into two parts, which leaves the spinal cord unprotected. There are 3 types of spina bifida: occulta, cystica, and meningocele. That's how you say it. Developmental disabilities, limitations on a normal life for somebody who has those. They cannot feed themselves, have trouble to live on their own, have trouble with their activities of daily living. They have trouble with relationships, trouble with working in a workplace, and trouble with verbal communication. Postpartum depression is a major depression in mother, also known as psychiatric disorder. Feelings of sadness, hopelessness, and thoughts of harming self or baby. Postpartum psychosis, severe form of postpartum depression. It is rare. Mother with this loses touch with reality. Delusions, hallucinations, suicidal thoughts, could harm, must not be left alone. Menopause, when menstruation stops forever. Rooting, when you stimulate a baby's cheek, babe will turn towards the stimulant and root, usually rooting for the breast. And that's the end of the test.